Hello, everybody. As I was introduced, my name is Federica Davila. I just turned 24, and I'm a fifth-year med student at Caracas, Venezuela. With my teammate and co-founder and co-director, Daniela Liendo, we started a project called the Green Cross that we never thought that would come this far. In Venezuela, there's an economical, political, and social crisis that's been going on for many years. But in the last few years, it has been getting worse very, very harshly. In 2017, people went to the streets and fell up like they were millions of people in the whole avenues, highways, everywhere. Everywhere was collapsed by protesters that were seeking to raise their voice, to share their ideas and share what they thought. This became very, very violent, and people started losing their lives. So Daniela and I, as medical students, figured out that as what we did, like what we studied and practiced every day, we had to help in some way. So we created this organization that we started with 4 people, and 1 month later, we were 250, between medical students and doctors with their masters and degrees already done. Our own professors from the university came in to help us, and the streets became kind of our school, our classes. We were learning on the streets, helping these patients that were helpless. People got injured there, and if there was no medical assistance at that point, they might have lost their lives. Thanks to our specialists and the doctors that were there with us, we saved many, many lives. We were there at the front line, in the middle of the riots, helping these people, taking them out with a team of motorcycles as well that took them to the clinics where they helped us as well, and make a real impact. We had a real impact on the protests because we reduced the mortality rates. We helped in this year, in this protest, we helped approximately 5,000 people. After that, when the protests and the riots stopped, we figured out that we had an amazing organization that could not be left out, that could not be, we could not lose that amazing power and faith that these people had to construct, to build the country that we want to see, to build the future that we want for ourselves. And we started doing interventions in the poorest communities. What happened? We started doing this, and we started figuring out how we as medical students and doctors know that the health system has broken down in Venezuela, and we had to do something about it. So thanks to the international community that had been helping us with this riot thing, and this started sending the medical supplies to Venezuela because we couldn't find them there. We have no medicine at all. We were able to donate these medicines not only to the patients that we helped in the protests and the march, but to the hospitals that have nothing. Today, what a hospital can offer to a patient is basically the knowledge that they have acquired in their studies, because we have no cotton, we have no solution, we have no gauze. It is an extremely harsh situation. So we've been working very, very hard to make this better. We need the international community to learn what's happening in Venezuela, to raise awareness, and keep helping us, because the medicines that you are sending are the ones that are saving the people's lives in our hospitals. We monthly give donations to the biggest hospitals in Venezuela so they can give these medicines to the people. Sometimes it's heartbreaking because we cannot get them as fast as the patient needs, and you see them die in front of your eyes, and you can do nothing. You can do nothing about it because you don't have the medical things that you need to treat a patient for illnesses that are so easily treatable. we have started seeing illnesses that had been eradicated for more than 25 years, and they are now back in Venezuela. Why? Because we don't have vaccines. So we need the international community to please keep on helping us, because you are making the difference. You who are sitting in that chair are making the difference for a patient in Venezuela that is someone's daughter or someone's parent or someone's grandfather, and it's important to someone. In the protest, we saw so many people die, and it was heartbreaking. When you see someone that is your own age, that has a future, that has plans, that has a family that loves him, or is even younger than you or older, and is shot dead because of fighting for their ideals, that is something that you cannot describe in words. That is the thing that is the motive and the thing that keeps us going to keep working and keep making a difference in Venezuela. So after this, we keep giving the hospitals the supplements that they need. We acquire from the international community, and we do interventions in the poorest communities that have no access to water at all. They don't have access to food. We ask them, what do you have eaten today? I have not eaten. What do you eat daily? Well, when I eat a plantain or a carrot with some cheese or something once a day. These people really, really need our help. And that is why I'm here today, to ask you to keep raising awareness for what's happening in Venezuela. Tell everybody what's going on, because the world needs to know what's happening. And for that, I will ask you, I will give you one little example. The treatment for malaria in Venezuela costs us $2.5. With $2.5, you can save a life of a patient in Venezuela. If each and every one of you here donates $10, we're saving 4 lives, only with $10. I'll give you all of our media and everything that you need to know. So if you're interested, you can donate. You can contact us to send directly the medicines that we need in Venezuela. We have allies in other countries that have been helping us and have been like our support for this throughout all the years that we, 2017 and 2018. I need to really thank 2 special allies that we have. One is called Dale la Mano un Hermano from Colombia. They have been our incredible support. And Venda tu Mano from Spain. You are the ones making the difference. You are the ones making the change and helping these people. We are just the hands there. But you are the ones who are making the change. So I want to thank the international community for giving us, paying attention, for raising awareness, for being as sensible as you are being right now, because these people need our help. These people are dying of hunger, are dying of the most treatable illnesses in the world, that in a first world country would be so easy to cure. That is not possible. By the definition of the United Nations of Human Rights, we in Venezuela don't have the right to food, don't have the right to medicines, and don't have the right to live. One of the most important rates that gives an alarm on the health system in a country is the mortality and fetal, maternal and fetal mortality rates. They have doubled in a year. Doubled. Mothers and children are dying because we don't have hospitals that admit them, because they don't have the medical supplies. They cannot get a lady who's in labor, literally in labor, and attend her because we don't have any medicines. We don't have nothing to do with her. We cannot help her. And that is amazingly sad. How do you say to a patient, go to another hospital. And she's been going to hospitals for 10 hours now. And she has 9 centimeters to give birth. That is something that we, as a group with teamwork, can change. You can make the change in Venezuela, and you can be part of the difference and the ones who help to improve the situation in our country. So thank you very much for being here, and thank you very much for paying attention to me. In our presentation, you can see the photos that we worked on. I will give you, if you text 70070 with the pound symbol and a number of pounds that you want to donate, that's the way here you can do it. Each and every pound counts. If you donate 1 pound, that's important. That's making a change. You can do it with Venmo. We can do it with Zelle. We have different methods. If anyone has any question, you can reach me later, and I will happily let you know how can you help. Thank you very much.